Hey everybody, my name is Dr. Michelle Grokey and I am an assistant professor in the community health department at Montana State University, and I'm also the health and wellness specialist for Montana State University Extension. And today your instructor, Dr. Brennan, asked me to speak to you for about 15-20 minutes or so about the work that myself, along with our team, is doing as it relates to prescription opioid misuse here in Montana. So I was originally supposed to come to your class tomorrow, Monday morning, but obviously due to COVID-19 and all of the issues surrounding that and the stay-at-home orders and everything switching to online classes, I am now just recording myself talking to you all from my home here in Bozeman. So anyway, before I really get started, I just wanted to explain for a minute or so about extension. And I'm sure Allison has talked to you about this before, but just so we're all on the same page. So every university in the US has two missions. So one of those being teaching and one of those being research, conducting high quality research. Now, every land grant university in every state has one of them. In Montana, it's Montana State, has a third mission. And that third mission is to provide evidence-based programming to community members of the state. And that's what Extension does. And so we have folks working for MSU Extension in all 56 counties of Montana. You may have heard of 4-H, our youth program. Maybe many of you were 4-Hers growing up. We also do a lot as it pertains to agriculture and production, helping producers in a variety of ways. And we also have the third and fourth realms are a little bit less known, but community development is one, and then health. We also call it family and consumer science. So within that health realm, both Allison and I work in the health realm. She's the mental health specialist. I'm the health and wellness specialist. I work a little bit more focusing on physical activity, stress reduction, mindfulness, and chronic disease management. But anyway, if you look around Montana State's campus, you'll see that there is about 33 of us that are faculty members, and we also work in Extension. And our main role is to find evidence-based solutions and to figure out answers to questions on pressing issues that pop up in Montana, and work with community members to do research and to provide programming to community members around the state. So that's sort of Extension in a nutshell. If you have any questions about that or anything I'm going to talk to you today about, please do not hesitate at all to reach out via email and let me know what your questions are. So I talked about Extension being very interested in addressing pressing issues, and especially, over the last, let's say 5-6 years, prescription opioid misuse has really been one of those issues. So we received two fairly large grants in 2018, and just to set the stage a little bit, 2 years ago, Montana had the highest suicide rate in the country. Now, thankfully, we're a little bit lower in the rankings. We also were noticing that many people were being prescribed from their medical provider a prescription opioid and then were misusing that prescription kind of down the line. And that was causing a slew of, health consequences, social consequences, job loss, all sorts of things. And so our team in Extension really wanted to figure out more about this issue here in Montana. So another kind of tidbit to know is that funding from a national level is really interesting. Sometimes you don't see a lot of funding come down the pipeline for a long time, and then all of a sudden a health issue gets a lot of traction, and then boom, 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 you get a lot of funding opportunities that you need to apply for really quick. So that's sort of what happened to us in 2018. So USDA, or the United States Department of Agriculture, put out a call for extensions services around the country to be able to apply for funding as it relates to the opioid crisis. And so we applied for that and we were successful. And then a week later, the SAMHSA organization, which is the Substance Abuse and Mental Health Service Organization, which is literally located across the block in Washington, D.C., said, we also have some extra money. We'd like to put it towards this issue as well. If you got the USDA funding, you're now eligible to apply for SAMHSA funding as well. And so, 2 years ago, our tiny team of 3 people kind of hurried up, wrote grants around the clock, and submitted for that funding too. We're successful in that. These are all competitive, so we weren't sure if we were going to get the money, but luckily we did, and that's allowed us to do quite a bit of research and prevention programming around the state. And that is what I want to talk to you all about today. So we again got two grants to do this work, and we do have a project page. I will also ask Allison to link to our project page on your G2L, so you can, if you're more interested in this, you can look there. But just kind of how things happen in the real world, the grant world, we were told, okay, yes, you got this money, but you have to focus on rural. And that's kind of funny here in Montana, because I would argue that all of Montana is rural, especially when you compare our rurality to a place like Washington, D.C. or New York City. But we had to actually break up Montana into urban and rural and kind of promise our funders that we would work more in the rural areas. And so I'm not sure if you all know this, but there are over 30 classifications for defining rural that we use in the U.S., which makes that very, very confusing. We ended up using one of those classification systems, and when you all read this, which I think you're reading next week, this is our output of this. We did a survey as part of our grants, and this is the summary report we wrote. And in here, you'll see how we defined rural, but essentially it omitted counties like Gallatin, Silver Bow, Missoula, Flathead, Lewis and Clark, Cascade, and Yellowstone counties. So if a lot of you, maybe some of you are from those counties or live in those counties, you go outside the city center a little bit, and that is quite rural. And so unfortunately, we tried to make that case to the funders in DC, but weren't able. But as I explain what we did, you'll see that we were certainly able to impact community members still living in those areas. But back to my point here, we had to design our programs based on 2 constraints. So one was that we targeted rural, and the second constraint was that we really focused on getting assistance to older adults. And that was something that we were also quite passionate about, considering that Montana is an aging state. We have more people in their 50s and 60s than the U.S. does, on average in states. And so we wanted to also really make sure that we targeted that demographic in our work. All right, so our grant money came in 2018, and really we had 2 questions that we wanted to answer throughout these projects. And just to tell you all, the projects now end in September of 2020, so we have a little bit of time left. But certainly due to COVID-19, we've had to change a bunch of things here in the end. And so we're going to ask for an extension, and we're also going to apply for more funding. So it's not that this work ends when these 2 years of grant funding ends. So the 2 questions that we wanted to learn more about, one was really, what are the perceptions that Montanans hold when it comes to opioid misuse? Do people think it's a big deal? Have people been struggling about this? Do they talk to family members or community members? What are their opinions? What are their views? What are their perceptions? So that's really the first thing. The second thing we were interested in were the prevention methods. So we know that a few things really, really work when it comes to reducing opioid misuse in communities. And so the first thing is making sure that each community has a take-back box. So I don't know if you've seen one of these. We have a picture in our survey report. Maybe some of you have used them. They essentially look like this. There we go. There's my camera. And they are secure boxes where you can drop off unused prescriptions so that they don't get into the hands of other family members, community members, So it limits the misuse of opioids and then getting from, to a person that wasn't prescribed them in the first place. So we wanted to better understand, would people use these things if we worked with law enforcement, if we worked with Department of Justice, some of these Take Back Box campaigns as extension, would people be willing to use them? How far would they drive? We know, especially if you live on the eastern part of Montana or along the High Line, it could be quite a far drive, to a city center, town center. Would you go there to do this? The second prevention method that we know works are using deterra bags. And so here's another photo. So when you read this, you'll read all about these things, but these are bags. There we go. The brand is called deterra. Other companies also make them, but they essentially have a chemical compound in them that neutralizes the chemicals in prescriptions. So if you don't, if you don't have a car or a way to get to a take back box, you can also keep these in your home and you can put up to 45 pills in them and add water. Then wait a minute, then close it. Otherwise, we've heard that they may cause a tiny little eruption. But it'll neutralize the compound in the pills so that nobody can get a hold of them. So in our work, we also asked, would people use these? If we got a lot of them, if we distributed them among senior centers, homes, would they be used? We also talked a lot about safe storage and whether or not people knew how to safely store prescription medicines and whether or not more information was needed. And really with all those things, a lot of what we were trying to figure out is, do people even know about these deterra bags? Do they know about take back boxes? And when do they think they would be most likely to be willing to receive the education? So those were the two kind of main questions we had in our grant, and that we have been trying to figure out over the last year and a half. So I just dropped something I wanted to show you. So one sec. All right. So in terms of methods, so how did we actually figure out answers to these questions? So we did two things primarily, and I'm just going to check on the time so I'm not talking your ear off here. So in terms of methods, we decided to, one, do a statewide survey, an online survey that also we printed, and for those that didn't have access to a computer, they could have filled it out by hand. And the results of the online survey are in this summary report that you all will read this week, I believe. And the second piece that we did is we drove around to 6 rural communities that we were, we had stronger partnerships with in the grants, and we conducted focus groups there. So I want to take a minute to talk about both of those methods. So the survey, we heard from, nearly 800 people, but unfortunately, because of both the rural requirements for the survey, folks had to live outside of those counties I mentioned before, and they had to be 45 years of age or older. So a lot of, you'll see in the report, we say here a survey of 379 Montanans. That is representative of the rural older population. So what that means is we can actually use these results to say, generally what rural older adults in Montana think about these questions. But we had many more people fill it out, and we couldn't use the data because they were either too young or they lived in an urban center. So the survey went really well. We had it open. We used Qualtrics. It's a online survey tool that MSU has a partnership with. And so I'm sure some of you have filled out surveys on Qualtrics, but pretty easy to use and to collect data with. And so we left it open for numerous months. And along the way, we did, we looked at the respondents. At first, we had many more females respond. So we did a push through our extension networks to get more men to respond. And we really try to kind of keep these demographic variables equal. We also looked at education level. We looked at income level. We looked at, all sorts of variables and made sure that the survey was representative of Montana as a whole. So sometimes we said, well, we need to even out the respondents in terms of income. And so we would target lower income or medium income based on that. So that gave us a lot of great data. Again, we wrote the summary for you all. And as the data was coming in, we very quickly tried to respond and produce other materials through the grant. So one piece that I wanted to show you is many of the first few respondents said, we don't know where to go for help. And we either know somebody who's misusing prescription opioids or, we are ourselves. And, we live in rural Montana and we don't know what to do. We don't know where to go. So we created this pamphlet called Responding to People Under Pressure Under the Big Sky with some funds from these grants. And you'll see if you open it and you have to, turn it. A lot of these, there's hard copies in Reed on the third floor. Reed 321 is my office. I'm 2 doors down from Allison. So you can take some of these if you would find them helpful. But basically it's a flow chart that says on the top, okay, a person is experiencing distress and, what are signs of distress? Because we were learning that a lot of people who were having issues with opioids were also experiencing distress. And sometimes this was leading to, thoughts of depression, anxiety, sometimes suicidality. And so this flow chart really, it's one of those, if yes, then you go this way. If no, then you go this way. And at the end, it really gives you a plan of action about what to do to seek help. And on the back are a lot of Montana-specific resources that anyone in the community can use to get help. So the survey, aside from giving us this summary report, really gave us some insight into what people were struggling with and how we could respond as folks, faculty and extension. And it really led to the production of a lot of handouts that people could use and take and hopefully learn from and get some information from. So the second method were these focus groups. And so I forgot to mention that when we applied for these grants, what we often do is in extension is the faculty members on campus will often spearhead the grant writing process. And we will basically email agents from all 56 counties and say, hey, we're interested in applying for a grant to help us with our opioid misuse issue in Montana. Do you want to partner with us? And some agents will be more interested in that topic, or they might be working in a community that needs that type of assistance more. So for whatever reason, there's lots of factors playing into this, but we had 6 agents respond to us that were very, very interested. And 3 were working on tribal reservations. So we work very closely with Fort Peck, Fort Belknap, and Northern Cheyenne Reservation on this grant. And we also work very closely with Fergus Petroleum counties, Powder River, and Rosebud Treasure. So the reason I have those grouped is some counties in our state have such few people that we actually have 1 extension agent for 2 counties. So it just so happens that with our grant, we're working with 2 agents that each have 2 counties they're responsible for. So Rosebud Treasure are together and Fergus Petroleum. So for those of you not from Montana, sorry I'm just spouting out county names and places in Montana, but if you're more interested, maybe you could stop my video and look on a map where all this is, but it's all east of Bozeman and then north with Fort Peck being right on the northeast corner of our state. So we have these local partnerships thanks to the Extension Network. And so myself and 2 other colleagues on this project went to each of those places and we held a focus group. And so that gave us some more data about, our initial questions. And so there we really tried to recruit as many people as we could, but also wanted to make sure that the focus group was representative. So a focus group, picture an interview, but with multiple people. You don't want too many. 10 is probably a good maximum because you want to hear from everybody. But as the facilitator of the focus group, you're really just asking questions and then letting the group talk and converse really amongst themselves and taking notes. It's actually a lot harder skill than you might think. Sometimes you want to ask a probing question and you really shouldn't. It's also difficult to get people to talk that are more introverted and tend to be more quiet. And especially with a sensitive topic like this, there was a lot of different opinions, small communities, a lot of people know each other. So they were a little bit tricky to facilitate, but we did have some very, very productive focus groups in terms of us getting a lot of great information. So types of people we had at these focus groups were law enforcement. Maybe not sadly, but a lot of law enforcement around our state have reported that they feel like they are A, on the forefront of this crisis, on the front lines, and B, they're not prepared and educated to be in that position when it comes to opioid misuse. So that was a big thing that we learned during this. We also had a lot of clinicians, doctors, nurses in attendance. We had a lot of pharmacists. They were very interested in coming, and the state of Montana has passed some pretty great laws in these last few years. One being, and it's kind of crazy that this law didn't exist before, but that when you go to your pharmacy to pick up a prescription, those pharmacists have to look in a state registry, national registry now, to see that you're not doing what's called doctor shopping, that you're not kind of going to whichever pharmacy you can to get access to more prescription opioids. And so now there's a really nice national database, especially if you live on a border town where you could easily go to Wyoming or South Dakota. All of these link to one another. And so the pharmacists were very, very adamant about talking about the importance of these laws and the importance of the judicial system in really helping curb this crisis. We had a lot of just concerned community members come as well. And so that was really great to see. Many people had or were suffering from misuse of opioids. Many had family members, community members. We heard, quite a few really disheartening stories. One, there was a garage sale going on in a small Montana community, and this older 75-year-old woman just kept, going to each of these garage sales every single week and was going house to house and always asked to use the bathroom. And so one of her fellow community members finally noticed and followed this woman into the bathroom. And it was then when she realized, or whoever the person was who found her doing this, but realized that she was misusing opioids and was using these garage sales as a way to get to people's bathrooms and to steal their medications. So we really found out that this, safe storage, safe disposal, those types of things will go such a long way in a community, especially like very prideful, people who are very independent, who, don't often want to talk about these types of issues. And yet a lot of this was happening right under people's noses. So it became very real after a lot of those focus groups had taken place, and really helped us to tailor some of our educational materials really to what we were finding out. Another example, and opening my drawers here, I don't think I have one of these at home, but in one of the focus groups, we had a lot of people who work with youth, at-risk youth come, and they said that a lot of the youth didn't know who to call when they saw an overdose or if that was happening. And they wanted something, not a huge sheet of paper or not like a giant pamphlet like this, but a little wallet card that they could just stick in their wallet, have in their pocket in case of emergency with all the local numbers. And so you'll see this on floor 3 of Reed once we finally get back to campus. But there are these little wallet cards that have information about who to call if you're in distress, who to call if there's an issue with opioids, who to call if you or someone is suicidal. And so those have gone out to youth across the state to help them in time of need. So at this point, we've collected all of our data. Again, you'll read about the survey data. If you have more questions about the focus group data, let me know. I'm happy to share that with you as well. And the way that focus group data kind of comes out is, I mean, they're transcripts that then get transcribed, and you look for themes, right? So what are the themes that are common across these focus groups? And so we've done that analysis and used it to inform a lot of the education that we've shared with the community. We've also created numerous presentations, community presentations, that agents can then give to their community members. And so here's really where it doesn't matter if it's an urban county or not. This information is spreading across the state. We just didn't send the survey out to people living in those urban centers, and we didn't do focus groups there. So, gosh, is it already 25 minutes? So I'm going to stop talking, but I really hope that just hearing a little bit more about the idea behind our grants, what we've been up to, how we collected the data was helpful for you all in your class. And again, as I said, if you're reading through stuff this week, feel free to shoot me an email. Happy to chat with you more about this project. And just so you know, we are applying for renewed funding for 2 more years. And here we're really going to be focusing on youth, those that are making a transition away from high school, to better educate them about the dangers of not only prescription opioids, but also, uppers, other types of drugs, and hopefully that prevents a lot of misuse from happening across our state in future years. So hope everyone's doing well and managing the online classes and enjoying your time at home and staying healthy and safe. And again, if you have questions, let me know. And thanks so much for your time.